Coming up today, donating stem cells or bone marrow can save a life. But in this case, the recipient and donor helped each other. How a selfless donation became a second chance for both donor and patient. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Anna Oliver describes her life as blessed in the mess. And it's hard not to get pretty messy after all she's been through. Her first cancer diagnosis was stage 4 lymphoma back in 2000. Since then, she has endured a harsh cycle that has lasted more than 20 years. Treatment, remission, recurrence, then more treatment. Until a complete stranger living 1,000 miles away offered her new hope. We are so privileged to be able to share their story with you this morning, and we're going to get to that. But first, we want to get to our morning rounds. When pain pills and injections stop working, spinal cord stimulators can help patients with chronic pain. Doctors here at the health system are not just providing this treatment, they are helping advance the science behind these implants. And this morning we are talking with Dr. Usman Latif, a pain management specialist here at the University of Kansas Health System. One of his patients recently became the first in the world to receive a certain upgrade to his spinal cord stimulator. Doctor, good morning.
Good morning.
Good to have you. So, Dr. Latif, can you just explain what spinal cord stimulators do and who they're for?
So pain is a natural protective response in your body. You touch a hot stove, you know to pull your hand away. You fall down, you break a bone, you know to seek health care. But sometimes that pain can become chronic and interfere with our lives. In those situations, spinal cord stimulation offers us a way to use a minimally invasive procedure to place tiny electrodes against the spinal cord to deliver electrical impulses that you don't even feel, that help your body turn down the volume on unhealthy pain.
So there are different devices on the market, we know, and you helped study the first device that uses artificial intelligence, and now the AI in that device is getting an upgrade. So can you explain the role of AI and then also explain the new upgrade?
So artificial intelligence has become so pervasive in our lives, but it's been very slow to make its way into healthcare. When you have a spinal cord stimulator, you typically have to come into the office multiple times to have little tweaks made, to have optimizations made so that it works well for you and gives you pain relief. AI allows us to take the data from 100,000 patients, customize that based on what makes you unique as an individual, and then deliver you new programs and optimization from the comfort of your home. About 2 years ago, when this technology first came to market, the very first patient to trial this in the world was here at KU. And over the next 2 years, I've been able to work with that company to develop the next generation and prioritize the features that are important to my patients. And a couple weeks ago, we became the first institution in the world to offer this to our patients.
So we spoke with the first patient in the world to get that AI upgrade. It's too early, of course, to gauge how the upgrade will help. But overall, he said the spinal cord stimulator has given him his mobility back.
I ride a motorcycle. Can do that. I haven't gone on long trips, but I can go a couple hours and it doesn't bother me. I play guitar in the band at church, and for the time from the injury until I got the implant, I had to sit to play. And my wife took a picture of me the first day I could stand and play, and it was 4 years.
William said that most days his pain has been reduced by 70%. Is that a pretty typical outcome?
So, you know, in any kind of treatment, you have to understand like what is considered success. And when we look at research in this field, typically 50% is that threshold. So as long as someone has at least 50% relief, we believe it works. And I would say for this type of stimulation, in the studies, we mostly are seeing 75 to 85% of patients being responders. Now that being said, over the last few years, there's been a lot of interest in these research studies to report on patients who are high responders, people who are getting at least 80% pain relief. And sometimes we're seeing as much as 50 or 60% of patients falling into that category. And one of the unique things in this particular new generation of the AI is that it is not accepting 50%, not settling for that, and actually striving to get more and more of these patients into that high responder group. So I would say that yes, this can be a typical result. Of course, results are never guaranteed. Every person is different. But I'm really excited to see how our patients now do with this new generation.
Well, Dr. Latif, thanks so much, and we want you back. We look forward to having another show, an entire show dedicated specifically to these devices. So thank you so much.
Thank you.
In the meantime, though, we are sitting here with someone who has been dealing with cancer almost half her life, Anna Oliver, and we are so glad to have you here with us today
Thank you for
at the
having
table.
me, Jessica.
Thank you. And we also love having Dr. Layla Shunay, one of Anna's doctors. She's a hematologist and medical oncologist here at the University of Kansas Cancer Center. Dr. Shunay, always a pleasure.
Thanks for having me here.
Good to have you. Okay.
Yeah.
And we're heading all the way up north this morning, way up north. We are so glad to be connected to someone in Saskatoon, Canada. Justin Redicott turned out to be the perfect match when Anna needed a stem cell transplant, and now his cells are part of Anna's blood. Justin, good morning.
Good morning.
So thanks for being with us this morning. It is exciting to have someone joining us all the way from Canada. So I want to start with you, Anna, because you were diagnosed with cancer when you were pregnant with your third child. They even wrote an article about you, I understand.
Yes.
Tell us about your diagnosis.
It was the year 2000, and I was 26 weeks pregnant, and I was diagnosed with stage 4B non-Hodgkin's lymphoma. Dr. Shunay can speak to the 4B, but my understanding is that they couldn't rule out the cancer being in my bone marrow, and so it was kind of the top of the line diagnosis at 26 weeks pregnant.
Yeah, break that down. What does that exactly mean?
It
Especially
means-
to someone pregnant.
Absolutely. I mean, it means extensive cancer. She must have felt the symptoms of that cancer. It was all over her body, and she needed to be treated no matter what. Even though she was pregnant and trying to protect her baby, she still needed to be treated.
So you went through chemo during pregnancy? Tell me about that.
Yes, at the time, there was no real studies about pregnancy and chemotherapy. They were, as my doctor said, at the time we were just trying to solve cancer, cure cancer. So with that information, my perinatalogist at the time said, I think the best thing to do here is just make sure you stay pregnant as long as possible. So that was the plan.
It's hard to get your head around that, right? I mean, you're just trying to keep a baby safe and get a baby here. So you got to follow the timeline here with us, because that was 2000.
Yes.
And then you fast forward 8.5 years and the cancer comes back. So Dr. Shunay, is that typical with a diagnosis like Anna's for it to come back?
Unfortunately, yes. Anna has T-cell lymphoma. When it comes to lymphoma, we have B-cell lymphoma, easier to treat, T-cell lymphoma, harder to treat. So I'm not surprised that it came back. Obviously unfortunate. I mean, Anna is a young mom, she's raising her kids. So to have that come back is heartbreaking, but it's not uncommon.
But with cancer number 2, you got your first stem cell transplant using your own cells, right?
Exactly.
But then 7 years later, it was cancer round 3.
Yes.
You turned to your kids to see if they were donors. Who ended up being your donor?
So that's kind of a long story, but our son, well, backing up a little, because I don't have full siblings, I have biologically full siblings I don't have, we turned to our children, and male donors are preferred. So we tried our oldest child, who's our son, and he came back from college and was tested, and unfortunately they discovered that I apparently had developed antibodies against him while I was pregnant with him. So they said that's a possibility, but it makes it a lot more complicated. So we went on to our daughters. Our 2 daughters were tested. They were identical as far as who could be a donor. So Brad and I decided we couldn't make that decision. We pushed it off on the staff and said, you guys decide which daughter. And ultimately they chose our youngest, who was 16 at the time, to be our donor.
And was this a success?
Yes.
At first.
At first, yeah.
Yes. Anna's daughter gave us the perfect cells. She endured a bone marrow harvest under anesthesia in the operating room. She gave us perfect cells. What had happened is the lymphoma broke through. So despite our best efforts, unfortunately, the lymphoma came back, not because of cells not working. The lymphoma is very crafty. That's what happened.
Crafty. Mm-hmm. It's sneaky like that. And so, am I to understand siblings are the first go-to? Full siblings would be the best match, and then you go from there?
So fortunately, in our world today, everybody has a donor.
Oh, okay.
Yeah, a full sibling is a donor, but most families have a small 2 or 3 children, so you may not find a full sibling, but that sibling could be a half donor. So with the advances in technology, even a half-matched donor is good enough for us. A child is half-matched, a parent is half-matched, a sibling could be half-matched or fully matched, right? So, and then outside that, there's the unrelated donor volunteer like Justin, 20 million strong, who could be our donor.
So you're saying we've come a long way.
So we have come a long way.
In those 20 years that you've been dealing with this.
Absolutely.
So you've dealt with cancer, round 3. How are you keeping it all together and being a mom and just doing life?
That's a loaded question, but yeah.
Let me have it.
Yeah, I would say first and foremost my faith and our community, but I've just luckily been a person with just a positive outlook, and I would say that my faith informs that positive outlook. But I'm a glass half full girl, and was able to use that to just keep imagining the next best thing in my life. So moving forward.
Well, a really good thing. Yeah, go ahead, Dr.
I gotta
Shane.
tell you, Brad and Anna and her family.
Brad, your husband.
Right.
Yes.
Brad, her husband, Anna, and her family. Amazing team.
And
Amazing
that
team.
matters. That helps, right?
Oh,
Because you can only do so much here.
Yeah.
And then you got to have the people at home
exactly.
for support.
I always say,
Absolutely.
Brad, every time I had cancer, every time I can say that because it was 5 times, but Brad would just put on his Superman cape and get to work, and he would make spreadsheets about how we were going to handle this, where the kids were going, all
Here's
those
some
things.
Of the kids.
Yep,
There's Brad.
there they are.
There
Yep.
you are.
Yep.
And yeah, so just a lot of help, a lot of help.
Well, and you look at it's always easy to look at pictures and everything looks great and lots of smiling faces and doing all sorts of things, but so much going on that we don't see. But I could see you pushing through to try to make those events and those milestones with your kids.
Absolutely, absolutely.
All right, somebody else that mattered in your life. You had no idea this was coming.
No.
Justin. So we want to fast forward to January of 2021. The cancer comes back. We're now at round 4. Justin, we want to bring you in. Well, Anna has, say hello first.
Oh, no. Hi. It's been a year.
How long has it been since you guys have seen? About a year? About a year.
Since we've seen each other.
About a year.
Okay. So, Justin, while Anna was facing cancer for years, you're living life in Canada. When did you decide to sign up on the bone marrow donor registry, and what made you do it?
I've always donated platelets, or I've been donating platelets for quite some time. And when I was going into one of my donations, they had a flyer at Canadian Blood Services here called the One Match program, which gave me a cheek swab or a DNA sample of some kind, and I put it in, and it took less than 5 seconds. Right, it was a very simple thing, and I threw it in, and I hardly gave it a second thought. I was like, well, if I don't know what the program is, but I'm willing to participate if someone could use the help. So I threw it in, and 10 years later, I got a call.
And that's usually how it works out. It's so easy to do. It's easy to forget you even did it in the first place. But then, you do finally get that call. What was that like?
It was jarring. The call. I didn't really know what to I didn't really know what to expect. I didn't know what they were wanting from me. But I was more than willing to do it. I was in. I was ready to go. I think for me it was just dependent on logistics and getting around what hospitals I needed to go to and stuff like that. And I was already going through several issues in my life as well. So it was a bit of a balancing act on my end as well.
And we're going to talk about that here in just a moment. Thank you for bringing that up and being candid about that. In the meantime, because we want to talk about registry while we're on that subject, what is the bone marrow registry called in Canada?
At the time, it was called the One Match program. It is. I believe it's still run that, but Canadian Blood Services runs all that. And anytime any of the donation centers that they have for blood or platelets or other testing that they do, you can get registered through the One Match program at any of the Canadian Blood Service programs.
Again, it's really easy to do. Here in the United States, it used to be called Be the Match, but they recently rebranded. So if you go to bethematch.org, which you still can, it will reroute you to nmdp.org. That stands for National Marrow Donor Program. You can check out the site, learn more about signing up to be a donor like Justin. So Justin, I want to bring up something that can be tough to talk about, but you were willing to do it. And we appreciate it. You were living with an addiction, an alcohol addiction. So many people are. How was that affecting you and your family at the time?
At the time, it was probably well. It was the worst. It was the worst it had been. Like I had started drinking regularly from between the ages of about 13 to 38. I was more often than not drinking pretty heavily, and it was getting worse and worse. And then as we were locked down, and as we were, coming in, it accelerated even further. So when I had in early 2021, prior to knowing any of this, my daughter had asked me. Actually, I came home one night, and my daughter asked me if I would quit drinking for a bit, not forever, just to try it for a little bit. So I said I was going to give her 100 days. I would say I'm not going to. Yeah, there she is. She's the one on the right. But all three of my kids are there, and she said, we'd love to. I'm nervous about your health. I'd love to see. I want to see you around for a long time. Can you please at least try to go without alcohol for some time? So I said to myself and to my wife there, I'm going to go 100 days, and I'm going to go and do what I can to get through this. So I started that, and on about day 14 is when I got the call from the donation.
Okay, that can't be lost on you, the timing. I don't think anything's an accident. Do you?
No, it wasn't. It was really an eye-opening experience because, yeah, if there was ever a time that I needed some divine intervention, it certainly came it was certainly at that point.
Well, again, thank you for sharing that story. I mean, doing it for your kids, your wife, and now you're getting healthy for a complete stranger. I want to go to Dr. Shunay. Have you ever heard of a donor needing to make lifestyle changes to help the recipient? Because this is something that he signs up 10 years ago. Lots can happen in 10 years. Addictions can come into our life. Pandemics can hit, and now he gets the call. So, what's a guy to do?
Goosebumps.
Right. I know.
Goosebumps. I mean, Justin had already committed to his children that he would change and be around for them, and then he has an opportunity to do something completely altruistic, completely voluntary. Justin, it was a divine sign for you. It's like, we need you, Justin. We need you. More people than you can imagine need you here. You have to fight through and come through for us. So thank you so much. I haven't heard of any other donors making life-changing decisions, but for Justin, it was the perfect time and the perfect decision for his children, for Anna, for everybody.
And we talk about the donors on our program. You are the heroes. It never gets old hearing your story. We do not take these lightly. It's the trajectory that you send somebody's life on, like yours, Anna. It's remarkable. So thank you again. But there was work to be done. You had to travel to make your donation, right?
Yes.
Tell us about that process, living in Canada and having to make all this happen.
Sure. So to be perfectly honest, I had no idea. I obviously had no idea who the person was, the recipient was. I was just told that a person was in need, and I automatically assumed it was someone from Canada. So I had to fly to Calgary, which isn't very far from Saskatoon, and they did a physical there, and they gave me the rundown of all the things that need to happen and all of the things that were going to happen. But they were very clear that this was no different of a medical intervention than had I had given platelets. It would just be a longer process, but not necessarily a more invasive or more harmful one. But
okay.
They did give me this. Go ahead. Sorry.
No, please go ahead.
I was going to say they gave me this medication to release the stem cells, which were self-injections that I took home with me, and in that lead up to it, he was the one who said, they weren't really sure, and alcohol consumption can affect the or this is what I took away from it, that alcohol consumption can affect the usefulness and the effectiveness of the drug, which made me really concerned, because now I really, at that point, as soon as I thought a light went off in my head that this was now a life or death situation. It wasn't. Now my sobriety needed. People's lives depended on it. So
right.
If I didn't have motivation before, I have motivation now.
Right. You had to kick that into high gear. Tell us about the broken refrigerator.
Yeah, so on July 1st, so July 1st is Canada Day, and so it was that's our long weekend. So July 1st, I had been on these medications for about a couple weeks at this point, but I came back from our cabin and our fridge had died. This is the first time our fridge had ever died, and these medications had to stay in cold temperatures. So I was complete panic. I was flying around, running around the house. I don't know, what am I going to do? How do I get more of this stuff? How do I get it? What am I going to do? I called down the Cancer Society or the cancer group in Calgary, the numbers that they had given me, and fortunately they contacted me back on the long weekend in Canada, and said, they looked into it. They called back. They checked around with the pharmacists and the oncologists there, and the medicine that they had given me was able to survive without being completely cool for about 36 to 48 hours. So it was fine. It worked out just fine. But for about 12 hours there, while I was waiting for the Calgary folks to figure out what they were doing, I was in complete panic. I had thought I had blown this whole thing.
Oh, I love it though. I'm picturing you like you've got the goods in your hand, and you're caring for them like your little babies, like I got to make sure I got to protect the little babies, make sure they get where they're going and those medications. And Dr. Shanae, I kind of want to follow the cells because after all of what's happening up in Canada, they got to get down here to Kansas City.
Absolutely.
So how quickly then do they get to Anna?
Same day, ideally. Same day, because Anna is already ready. She's had chemotherapy. She's waiting for the cells. She knows somebody out there loves her, is thinking about her, wishing good for her. So we're waiting for the cells. So Justin, as soon as we collect your cells, we're waiting here, and they arrive the same day, and we give them to Anna, and we're on to recovery. On to recovery.
Yeah.
Yeah.
Yeah. All right, lots more to cover with Anna, Justin, and Dr. Shanae. If you're watching live, be sure to ask your questions. Use the chat on YouTube or Facebook. You could email the Medical News Network. The information is there on your screen. So Anna, you wrote a beautiful letter to Justin thanking him for the donation. In it, you shared, though, another diagnosis. So you wrote in it, in part, it says, I can't thank you, or I can't tell you, I can't just tell you I'm fine and say thank you. Glossing over the facts, what came next. In late February, I began to have strange pain in my elbow, and eventually a lesion showed up. You went on to say, we really hoped it was nothing, but it was cancer number 5. So after all the treatments and the side effects and stress that you had been going through, how did you process that? You processed it before, but at what point do you go, I'm done doing this?
Not well, honestly. I don't know what it was about 5 that just kind of put me over the edge a little bit, but yeah, I really had to sit on that one and think for a long time. But I will say that this wonderful person here, doctors sometimes have good bedside manner and sometimes don't, and I've been told years ago that doesn't necessarily inform their skills. However, this one has both in spades. And just the way, Brad and I were kind of at a loss. We thought, is this it? We asked Dr. Shanae, is this it? Like, is this where we have to start thinking about trials? Are we going to the last ditch effort now? And she just calmly said, no. I think that we don't do that. Let's try some immunotherapy and let's see what it does. And thank God that's what we did. And 2 rounds of immunotherapy, and I'm back in remission and have been for like 30 months now. So
you got the big thumbs up from Dr. Shanae. That's all she likes to hear. But I have to ask, does that mean that Justin's transplant failed?
Not at all.
Okay.
Not at all. The tumor is crafty. The lymphoma is crafty. It showed up, we punched it down, and then Justin jumped on top of it. So he just needed time. He needed an opportunity to be able to do his thing. So it showed up, we put it back in remission, and then Justin completely took over. So when you look at Anna's blood, it's 100% Justin. 100%.
100%.
100%. And Justin is keeping the lymphoma away.
Well, and you said when you saw Justin this morning on the screen, before we started the program. You said, it's just crazy. I walk around, I've got his blood running through my body.
When I was in the hospital getting ready to get Justin's cells, since I didn't know who it was, I just called him my new Cella fella. And so that was my nickname for Justin. And so until I got to actually put a name to the cells. So
your Cella fella.
My new Cella fella.
Justin.
Yep.
So, but despite number 5, the cancer coming back, you and your family, you were able to get on a plane? You didn't have to drive to Canada. You get on a plane, go to Canada?
No, we actually drove.
Okay. Oh, you did? Okay.
We've driven a lot because of COVID, because of me and my immune system suppression. We've been in a car a lot together. And so actually last October, we put the dogs in the car and made sure we had all their papers, and the 4 of us drove to Canada. Yeah. And we
all right, so I want to share the moment we always want to see, which is the moment you guys get to see each other, meet each other. What was this like for you, Anna?
It was amazing. We were driving up, but we had kind of been keeping in touch via text, and I said, you know, if we get in town in time, we'll stop in on Friday. If not, we'll see you on Saturday. And it was getting kind of later in the day, but the closer we got, I just thought, I have to see him. I have to see him now. If I'm in Saskatoon, I got to see him now. So we just said, we're coming by.
We're coming by.
We're coming
for you. Justin, what was it like putting your arms around her like that? What was that feeling like?
It was pretty surreal. Like she had mentioned that she was coming up, and I thought, you know, Kansas City's a long ways away, so I was sort of like, well, this takes a bit of coordination, but it didn't. She said, I'm coming up, and that's the end of it, and I was okay. Well, we'd love to have you up here.
Yeah, you're dealing with a woman who's battled 5 rounds of cancer. I don't think you're gonna keep her away anytime soon. It's not going to happen. So tell me about some things you did. Did you take them anywhere? What did you guys do up there, Justin? What was one of your favorite memories?
So well, Friday we just spent the night in the house. We got to know each other a little bit, and then on Saturday, there's a few places around Saskatoon that we went to that just showed off a few of the things that we did. Fall in Saskatoon is actually quite nice. There's a lot of trees and there's a lot of foliage around, and the harvest's done. So it's a nice time to be. It's a nice time to be around Saskatoon. And then on Sunday we watched the Chiefs game. So they were, we had it all set up in the basement, and us and the kids and everyone was in our jerseys and everything, and we were watched the Chiefs game. It was very nice.
Okay, so did she push the Chiefs onto you, or were you always a Chiefs fan?
She did. She really did.
You're not getting out of this.
I watched, because I've watched football, both CFL and NFL for a long time, but lately I've been watching much more NFL, but I've never had a team. I just was watching up here, you know, in the cheap seats of Canada. I didn't know what have a team to be assigned for. A lot of folks around here are either Packer fans or Viking fans, Northern teams. But then I didn't have a choice. Her and Brad were, you're part of
No.
They sent me up a Travis Kelce jersey and all sorts of other Chiefs gear, and then so I got that now. And as soon as I joined, they started winning. So I don't know if it's something I did, or
I'm sure it is. It has nothing to do.
But the moment I showed up, they started winning. So it's good.
I know. Everybody was saying it was Taylor Swift, and now we know who it really is.
I might have something to do with it too. I don't know how much. I'll probably say, but it's been a good trip. Yeah.
Hey, you donated, so we're giving you the credit. You deserve that.
Ask him about the barbecue.
What about the barbecue?
Yeah, we have some barbecue up here, but it was a once in a lifetime experience. They brought all sorts of Kansas City barbecue up and had it sealed up and in dry ice and everything. And so while we were watching the Chiefs game, they had reheated all this barbecue. We had all these barbecue sauces from across Kansas City. I still have a bunch. I eat them all the time. They're fantastic. I had never had such good barbecue in my life, and to have it while we were watching the Chiefs game was really the highlight of the whole weekend.
Yeah, kind of just like the perfect day. And I know you've had a chance to thank Justin many times, but is there anything you want to say to him here this morning?
Yeah, hopefully, Justin, you know how thankful I am. I've said it in texts and emails and in person, but it sounds cliche to say there aren't words to really describe this or thank you enough, but there really aren't. But the fact that I'm walking around with your blood and that is sustaining me at the moment and hopefully forever is just something super special that will always have that bond. So I felt like when we got to Canada and when we left Canada, I felt like I just gained family, honestly. Felt like gaining family. So, but thank you so much.
And we talked in the beginning of this program about, two people saving each other. Justin, anything you want to share? I know you did this for your family, and then along comes Anna to push you along. Anything you want to say to her?
Yeah, it's been so nice to have someone at a great distance who it's so funny that we are so genetically identical that we are able to do this and everything. But like when you came up and visited, the only thing me and my wife have ever described it to anyone who's asked is how was it? Is like it was as if family was visiting. It was immediately comfortable. There was no hesitation. There was no nothing. It felt like we had known each other for decades already. So we've talked about this a lot, and I'm happy I did it, and I would do it again. And if you need anything else from me, if you need more blood or anything, I've got lots, so you can take what you need.
He's got the blood, you got the barbecue.
That's right.
I think we're in business. I love this. I want to get to some questions and some comments from our viewers this morning. Gene, thanks for writing in. He says, what a great story. Jeremy says, I'm still stuck on the concept of dealing with cancer 5 times. Holy cow. Just wanted to praise your fortitude and perseverance. Great job powering through, and so glad that you're doing well now.
Thank you.
Jill wants to know, Justin, you mentioned it. Jill wants to know, can Justin donate again? Dr. Shunay, can you answer what if somebody does it once, can they do it again?
Maximum 2 times.
2 times. Okay,
Yeah.
so, all right, sounds good. Jake is asking if Justin would have started drinking again, could he have been qualified to be a donor? I mean, how important was it that Justin stayed on track?
Very important, because alcohol affects stem cell production. The fact that Justin sacrificed and chose to stay sober really saved Anna's life. So I'm really glad, Justin, you did this the right way. Yeah.
Goosebumps, you said.
Goosebumps.
Lots of goosebumps. Okay, Becca asks, what are the most common reasons why a transplant wouldn't work? And is there any way to predict success?
It's a very good question. The problem is not the transplant. The problem is the cancer that is crafty, that tries to come through. And we have ways to prevent that. And if it happens, we don't panic. We just go on to the next thing. And that's what we did with Anna. There's nothing to worry about. It happens, we move on to the next best thing. So donors, you guys give us the best cells in the world. You do. That's not the question. It's the cancer is crafty. Yeah.
Ruth Ellen, thanks for watching this morning. Great story, amazing to both of you. Stu says he knows different patients have different transplant recovery times. How long did Anna need to stay isolated after each of the 3 transplants?
So there's an initial 100 days of really being locked down, and then there's an ancillary time afterwards where you have to just still be really careful. Obviously, COVID complicated everything, and so I just felt like years, it was years really, that I just was really careful, and I'm still careful to this day.
Dr. Shunay, what's the big takeaway from this story? I've been watching you just smiling across the table, just letting this kind of unfold. What do you want people to take away from this story?
This is a story of love, and helping each other. Anna has cancer. She's a young mom. She's fighting to be here for her kids. Justin is fighting to be here for his kids. And we're connected with this intense love for family to save each other. It's a beautiful story.
Justin, again, thank you for being here with us from Canada this morning. And your gift, thank you for the gift you gave Anna. What do you want the big takeaway to be from this story?
Yeah, actually, I have a message a little bit for people who would be considered who would consider joining something like this. I can't speak to anyone's experience in the United States or anyone outside of Saskatoon, but I never found anything but love and support from the staff that did it. The actual process itself is not it's not a huge sacrifice for time or for effort, and I think that the opportunity to have the experience like I did is definitely worth a few minutes to just sign up and see if you're eligible.
Thank you again for sharing your story and being so open and candid with us this morning. Anna, what's the big takeaway from this?
I'm going to piggyback on Dr. Shanae a little bit. In one of my blogs, when I was dealing with one of the cancers, I called it Cancer a Love Story. And, I feel very blessed to have had so many people really gather around us through all 5 cancers. And, when you've had it that many times, you're pretty highlighted. People know so much about you. But I walked through cancer wards and saw people alone. And so Justin and I have this connection. He did this amazing thing for me. But that's not all, I guess. There are so many ways you can help people. And obviously, being a donor is a huge, huge way. I will just say that we were blessed by so many people, and our kiddos kept us entertained from afar when we were going through all of this, and we had neighbors and friends and coworkers and family. People put me up in their home when I needed to be kept safe, and cleaned my house and renovated our house. I mean, so many things happened. And so I would just say, takeaway is look for people that need you and help them. And Brad and I try and do that now. We try and pay it forward as much as we can. So I would just say be there for others.
Thank you for being here.
Thank you.
Be well.
Thank you.
Thank you.
Thank you.
Thanks to all of our guests
you.
today. Thanks to our viewers for being with us. Have a great weekend.
Thank you.
Coming up Monday on the Morning Medical Update. No scalpel, no radiation. Doctors can now use the power of sound to treat prostate cancer. I'm Jessica Lovell on the next Morning Medical Update. High-intensity focused ultrasound. Meet a cancer survivor who avoided serious side effects thanks to a newly approved precision treatment. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.